So I want to speak a little bit now about healthcare in Palestine. And then I will get into the current situation with the coronavirus, but I think it's helpful to have some context. Of course, I'm sure most of you know, when we speak about Palestine, we need to understand that the Palestinian people are divided and isolated in their own homeland. Palestinian territory is divided into unconnected regions, the West Bank, East Jerusalem, and Gaza. And then it's further divided within these regions by separation walls, checkpoints, blockades, refugee camps, Israeli settlements, all of which prevent freedom of movement and connection among Palestinians. At present, there are more than 600 physical blockades and obstacles to movement in the West Bank. Now, from a medical sense, these barriers and divisions act as an obstacle to health. They inhibit the right of Palestinians to healthcare by restricting the movement of patients, doctors, ambulances, and medications within the area. So going back a few years, following the 1993 Oslo Peace Accords, the Palestinian Authority and its Ministry of Health were given responsibility for the administration of healthcare in the territories. Yet the PA does not have full control over the healthcare system. Israel retains ultimate control over healthcare budgets, border crossings, building permits, and very importantly, pharmaceutical imports and exports. Consequently, Ministry of Health hospitals are pretty basic, certainly in comparison to hospitals in Israel. And they lack many of the resources that you and I take for granted, especially those relating to imaging and specialists. Doctors in the West Bank and Gaza have very little opportunity for training and professional development. And the result is that Palestine has 8 times fewer specialist doctors than there are in Israel. So both of the Diocese of Jerusalem hospitals, St. Luke's Hospital in Nablus in the northern West Bank and Ahli Arab Hospital in Gaza, are basically charity hospitals. They serve particularly vulnerable populations. These are adults and children living in extreme poverty who have low levels of education, typically poor nutrition, and generally unhealthy lifestyles. They have higher than average rates of unemployment. And all of these are direct risk factors for chronic illnesses. And these conditions are driving a dramatic increase of non-communicable diseases, such as diabetes, hypertension, cardiovascular disease, and cancer. And these are replacing communicable diseases as the main causes of morbidity in Palestine. So when you visit a Palestinian hospital or clinic, you often hear the word inshallah, the Arabic phrase for God willing. Patients placing their health in God's hands with the outcomes predetermined. And part of the reason, I think, for this fatalism is that so many Palestinians lack access to quality healthcare and health insurance. They often visit clinics for serious ailments only to learn that the required tests and procedures are either unavailable or out of reach because of cost. And sadly, many are seen in clinics for the first time when they're already in the late stages of their illness. But it's important to note that access to quality healthcare varies depending on where a Palestinian lives in the occupied territories. For instance, a child with cancer who lives in East Jerusalem might have access to Augusta Victoria Hospital on the Mount of Olives and receive comprehensive treatment. For a child in Gaza with the same diagnosis, that could well be a death sentence.